With a lot of people getting the healthcare assistant jobs with visa sponsorship, some people don't even want to go through this route because they believe that the career prospects for healthcare assistants in the UK is not actually a very straightforward one. But in this video today, I'm going to share the career pathways for healthcare assistants in the UK with a very useful resource that will help you to know how to go about this when you get to the UK. Okay, so let's get into it. Hi, welcome and welcome back to my channel. If you're new here, hello and welcome. My name is Lynda Eze, and on this channel I share information about nursing abroad, getting jobs abroad, remote job opportunities worldwide. So if you're interested in any of those, be sure to subscribe and always come back for more. And for my returning subscribers, thank you so much for your feedbacks and for always showing up in this channel. So the resources I'm going to be using today is from the Royal College of Nursing, which is one of the biggest healthcare bodies in the UK, and they have provided everything that you need to know when you want to transition from a healthcare assistant role or support worker role to other healthcare positions in the UK. So let's get into it. There are 3 of these pathways that the RCN have already put out for people to actually go through, but I'm also going to share with you resources that will actually make these things explicit, so you want to stay to the end of this. The first one is Nursing Associate Program. This Nursing Associate Program is a 2-year program in the UK, and you will be paid on a band 3 level because you will be working and studying at the same time. So when you finish this course, you are going to have a band 4 position, a Nursing Associate position as a band 4, and then it is regulated by the Nursing and Midwifery Council in the UK. So this particular course, when you finish it, you can also progress to become a nurse by doing a top-up program. So when you finish this course, you are still not a band 5 nurse, but you are also referred to a nurse associate, and it is fully regulated by the NMC. Now I'm going to leave a link in the description below so that you can go and also do your research and read about it. It's called the Nursing Apprenticeship Program. Now, this apprenticeship program is a 4-year program that will lead you to a band 5 position as a nurse. Now, this one is also fully regulated by the Nursing and Midwifery Council, and unlike the Nursing Associate Program, which will lead you to a band 4 position, this one will lead you to a band 5 position. So you are a full-fledged nurse when you finish the Nursing Apprenticeship Program, but it is a longer route. As you can see, it is a 4-year program, and you can also be working and studying at the same time. So it's also a good one that many people are also using. So it depends on the one you actually find very helpful, because since you're also working and studying, you might not feel the impact of only studying and you are not like getting any salary. The third one is called the Assistant Practitioner role. Now, this Assistant Practitioner role, unlike the 2 that I have mentioned, it is not regulated by the Nursing and Midwifery Council in the UK, and it will not lead you to a nursing position, but it will help you to, it is an 18 to 2 years program, and you can use this particular role to get a shortened degree in nursing. So there are different ways you can get into any of these programs according to the Royal College of Nurses, and those ways, he said, the first one is that you speak to your employer for more information on the opportunities that they have already for their employer or for their employees. Okay, and the second one is that if you are unable to apply with your current employer, inquire with other healthcare employers and or NHS trusts about possible opportunities. Remember, I always mention that when you get employed you can still change employers. Like if they don't have the required resources that you need to grow, you can actually change if you choose to. Then the second one is, another one is that you need to speak to the universities that offer this program and see if they are willing to take you. You can actually look in NHS jobs to see if they have like nursing apprenticeship roles. So when you get them, then you can actually change to change. The next one is that you can also contact your RCN learning rep. So they have learning reps in Royal College of Nursing that help people to progress in their career, including nurses and other healthcare professionals. So if you are confused, you can go to the Royal College of Nursing website and look for the learning reps, and then you can contact them by email or you can call them on phone, and then you actually ask them of the opportunities that they have for healthcare assistants to grow in their career, and they will be able to help you as much as they can. Another one is that you can also contact your practice development team and see if they are able to help you out. So I'm going to leave a link in the description below so you can explore all of these by yourself. So next is the resources I said I'm going to share as well. This is coming from the RCN website as well. So there are 3 areas that healthcare assistants or support workers can actually use to progress in their career. The first one is changing. So when you get a healthcare assistant job in the UK and you don't like the environment or you have interest in another area, you can actually change from adult to children to community and other areas. That's the first one. I'll leave a link where you can find these resources as well. The second one is education. I didn't even know. I came across this as I'm getting ready for this video. So a healthcare assistant or a support worker can actually move into an education position. I usually see them during our trainings, but I didn't know that healthcare assistants can actually move to those roles. So what they help is they actually support other training, other teachers, and so it is usually in a healthcare practice. And if you have interest in this, you need to speak to your clinical development team and see if they have positions for that, and then they would show you how you can go about joining their team and all of that. I found this really very interesting. It's something I also didn't know existed. It was when I was going through this career pathways for healthcare assistant that I noticed this. Is also research. So healthcare assistants and support workers can actually go into research as well, in the sense that they say is healthcare assistant a research practitioner. So under this, you can actually, it's usually in a hospital setting, and if you are interested in a support role, they said do not be afraid to ask your clinical development team how you can go about it, and they will show you. And this actually made me to actually think about people that come to collect data and all of that in my workplace. Them actually use this from support worker to a research position, and this is really very important for some of you that already have a degree and you are coming in as a healthcare assistant. This is actually a good platform for you, because if you already have this background in research and then you talk to them about it, that you are interested in this research part of it or education part of it, or you want to move to another role, then it is actually a good platform for you. Because if you start working in a research area and you are very good, you can take some courses and also progress to become a full-fledged associate researcher or even a clinical researcher as well. So I hope you found this video helpful. If you did, please smash the like button for me so that a lot of people will be able to see this. Share with someone that is really worried about this pathway to the UK, and share with someone that is already in the UK that doesn't know exactly what to do. Subscribe to my channel and always come back for more. I wish you all the very best as you apply, as you come to the UK or in your UK journey, and I'll see you in my next video.